Okie doke, we're in the home stretch. Assessment part 3 of 3. Let's do it. Information about evaluation reports. So we talked about the occupational profile, we talked about the assessment process, the reports, etc. Now we're going to talk specifically about what's in an evaluation report. The report will identify the needs and abilities of the client with a slant to occupation, right? An occupational performance. It'll also identify the purpose of using each standardized instrument. So there'll be a little blurb about each test. It will report the child's performance on each test instrument, explain how the child's performance will impact their daily function and skills, and report on the child's strengths and assets. Now, this part can be used to enhance treatment. We never want to put in stuff that's not true or just is sort of superficial. We want to actually report on real identified relative strengths. So here's an example of a little bit of a report. The developmental test of visual motor integration was administered, and the child demonstrated difficulties precisely drawing various geometric shapes. He used an excessive amount of force when completing paper and pencil tasks. His posture was slumped over the table, and he often rocked while seated in his chair. His ability to accurately draw the various geometric shapes was substantially below age expectations, and he did not independently check the accuracy of his work. He needs explicit directions to check the accuracy of his work in a classroom setting and would benefit from visual models to support his work. So within this excerpt of a report, we have standardized assessment information, we have clinical observation assessment information, we have recommendations, we have how it affects the child in their functional lives. Okay, so this is your job for class prep for the next time we see each other. Using that test result sample, I would like for you to do the following. Make a concise list of the presenting problems. Now, this seems deceptively simple. When you go through that paragraph, I want you to pull out the possible issues and put them in a structure that makes sense, okay? And also prioritize, cut down, don't just cut and paste the sentences, okay? That's a skill that we need, is the ability to summarize the presenting problems. I also want you to indicate whether the issue is motor, sensory, perceptual, cognitive, or something else that you note. You don't know for sure what the root of the issue is because in an assessment, we're just checking out hypotheses, and we may need to check it out some more. So sit as comfortably as you can with not having all the information, and we will just take a shot and note how you built the hypothesis that you came up with, okay? And we honestly don't know. I don't have like a cheat sheet that says this is this and this is this. Try it, see where you get to. Use your clinical reasoning, and we'll talk about it in class. So from that, my other question for you is, what functional school-based difficulties might you expect to see? Okay, and we'll say this kid is 7 years old. All right, so that's your job for next class. Let's now turn to a slightly different topic and talk about types of assessments and specific pediatric tools. We're going to go through this relatively briefly because there's so many different tools. And what I want you to know is that there's a lot of different kinds of tools. They serve different purposes, and there's a tool for the job that you need, right? And finding it is the challenge. A lot of organizations will have a set of evaluation tools that you will use. So they'll have certain tests that they just use, and you can use them too. Assessments focused on occupational performance. They often have something to do with developmental expectations. The data is obtained through observation and interview, and the PD, the WeFIM are examples. And sometimes data is obtained through child self-report, like the COSA or the PEGS. Then there's assessments focused on client factors within a context. So data can be gotten through direct performance, observation, or adult report. It's usually standardized with normative scores, so a norm-based assessment. Examples are the MFUN and the Bailey. And if we're talking about teens or adult report and observation, forget the teens. If we're talking about adult report and observation measures, the sensory profile school companion and the sensory processing measure are options. This is a reference slide about specific tools. So it covers the Denver Developmental Screening Test and the Bailey Scales of Infant Development. What I want you to do with this and some of the subsequent slides is put it in the back of your brain. And when you get your first job in pediatrics and you're like, I don't know what all these things are, you can think back and go to 226 and pull up some of the stuff that you saved, and it will give you a little window into some of these tests. Okay, so I'm not going to go through it. I'm not going to test you on it, but I want you to have it for reference, as it says on the top, for reference. All right. So, and this is, just to let you know, this is exactly what I did when I went to OT school at San Jose State. I was an undergrad. I learned all this stuff. I could barely remember any of it. I got a job. I was like, oh my God, what am I going to do? And I went back to my notes, and there it was. So here it is for you, paying it forward, yeah? Okay. The Battelle is the instrument on this slide, and it's for young kids. Then we have the Peabody and the Bruinix, and these are very common, so it's good to know about these. There's also ADL assessments, the PDCAT, and again the Battelle, which we just saw. And then we will, I'm going to let you watch these videos, which are linked in the presenter notes, yourself. And then when we're in class, we will practice calculating chronological age. But I just want to introduce you to it in this video. Okay. Oh, my window just changed size. Hopefully it doesn't make things look weird for you. Okay, so why do we, here, I'm going to go back to this slide so you'll listen to me and not read the slide. Why do we calculate chronological age? Well, if a child is born premature, their chronological age, right, so how many weeks, months, years old are they, is different than their gestational age or their corrected age. These are two terms for the same thing. So say we're seeing a child who is 12 months, 0 weeks old, just for simplicity, but they were born 15 weeks early, right? So they're not actually 12 months old or 52 weeks old. They're actually less than that, right? So 15 weeks less than that because they were born before they could fully develop. So we correct for gestational age, but first we have to calculate what their chronological age is from birth to today in years, months, and weeks. So let me go to this slide. Okay, I'm just gonna make this a little bigger. Sorry to do this while we're meeting here, but I'm scared that it's not gonna look right. All right, that's what I think I can do. Okay, so we basically express their age, their chronological age, year, month, date. And we subtract the child's birth date from the test date. And as I said, There's videos that are linked in the presenter notes that I want you to watch. They're short, 5 minutes, and we'll practice it. So we then correct for prematurity, as I said, and depending on the test instrument, we may correct up to 2 years old, 30 months, or even 48 months. Typically, I see us correcting at 24 months. That is the most common, but we need to check the test administration manual to see for sure. Alrighty. Okay, so here's the video on correcting for chronological age and the link. Then correcting for prematurity and the link. And for your reference, again, I'm not going to dig in and test you on all of these terms, but I want you to be familiar with them because when we're talking about evaluation and assessment in pediatrics, we need to know this information so that we can pass it on in our reports. So there's a number of standardized assessment scoring terms. Raw score, that's what we get. Standard score, that's what we convert it into. Percentiles, central tendency, which you're probably familiar with from research, stanine, ceiling, and basal. So if you have any questions about any of these, please, please, please ask, okay? We also have a number of different kinds of validity in tests. So not only is there validity in research, but there's validity in standardized assessment instruments. And we have reliability, different measures of reliability. So the higher the validity and reliability in the Roche analysis, which is another way of measuring the quality of an assessment tool, the more we can rely on it, right? So that's why we use those. All right, got a couple activities for you. These are for your reference. You don't have to turn them in. We can discuss them if you'd like, but we don't need to. So review the case study of D. He's 6. He's diagnosed with Down syndrome. He's at a private clinic. He has a number of issues. What are some of the standardized assessments that would be appropriate in evaluating this child? What I would do if I was you is if you have already taken Occupational Therapy 216 assessment, go back to that. If you have a book about assessments, go to that. Failing that, go to Google. There's some great OT websites that cover standardized assessments and just give you a synopsis of them. You need to make sure that the information that you find there is relevant and reliable and valid. And I'll look it up and I'll put it in the final version of the slide deck so you have it. I'm thinking of a website, I can't think of the name, but go there, browse around, okay? And also browse the slides. So what would you anticipate the results of your evaluation might indicate? What issues do you need to consider before providing feedback to the parents? And this brings up family-centered care, grief, evaluation results, etc. How might you establish a relationship with the parents to support them? And what personal preparation will be necessary so you can be present while providing feedback to parents? So this question is kind of getting at the fact that it's hard to tell family that their child is not developing typically. It's really hard. Even if it's a kid who has Down syndrome and they knew from birth that this was going to be tough, it's still tough. Every time you get more news that your child is not progressing at the rate that you would like them to be and is not on par with other same age peers, it can be very difficult. So as a result, we need to take care of ourselves so that we can be available to both present the results and also to take care and support the family. All right, and then there's just some specific test review, and you can look back at the slide deck and just get that information. So it's just a way to cue your brain a little bit. All right, congratulations. You made it to the end of the assessment lecture, and please bring any questions that you have in class. There is an exercise that we'll discuss in class. We'll also, as I said, review the chronological age and the adjusted age. All right, everyone, have a great day. I'll see you soon. Bye-bye.